Okay, based on Eric's discussion with me and revelation of his migraine headaches and the possibility that there may be some component or some factor with the masturbatory system in his headaches, we discussed with Eric the possibility of ruling that out. And the way we do that is we make an appliance, and we talked as far as the etiology of the occlusion or the bite of the jaw function with the headaches. It was basically a result of muscle activity that was dictated by the teeth not fitting and functioning where the jaw muscles really wanted to function. And so we have an appliance that allows the mandible to close where it wants to close. We understand, Eric, as I shared with you before, that where you actually close, where your jaws actually work, is really largely dependent upon how the teeth fit together. That your teeth have pressure sensors in them. Your central nervous system, or your brain, knows what's going on at the level of your teeth. They know the amount of pressure, the direction of pressure on the teeth. And what happens is those pressure sensors or pressure impulses go to the brain. The brain in turn sends an impulse back to the muscles, and the muscles in the jaws function accordingly. So in kind of a sense, your jaw muscles and jaw function is kind of a slave to where your teeth fit together. And we suspected the possibility that that may be a factor in some of the problems you're having with your migraine headaches. Also, it may be a factor in some of the wear and damage that we're seeing on your front teeth. So what we wanted to really find out was, okay, when your muscles, if your muscles were given the opportunity, if your jaws were given the opportunity to function where they physiologically wanted to, where would they go? What would they do? And that was the purpose of the appliance. And if you could just take that out, Eric, if you could just show Terry here what this is like. Again, for those of you who haven't seen before, this is a Coisty programmer, and it looks very much like a standard Hawley retainer, except on the very front, there's like an island, as you can see, that's built up right behind the upper front teeth. And what this island does is to keep the back teeth apart, essentially. And what we understand is that the back teeth are just very slightly apart, that there's no pressure sensor, no pressure sensation going back to the brain. The muscles go through a process that we call deprogramming, and the jaw is basically free then to go where it wants to go. And that's really the purpose of the appliance.